go. Now I can turn my back there because I don't need that anymore, right?
Right.
Be very careful. Look right here. You don't want your gloves to touch the legs, okay? So I'm being very deliberate about where I'm putting it. Okay, Mr. Evans, we're going to insert your catheter. I'm going to start by cleaning. As soon as you grab, this hand is no longer clean or sterile, okay? And see how I probably.
Yes.
Oh, no, just clear my throat.
Okay. See how I put this here instead of anywhere else because it's real close, okay? Okay, so what do we clean first?
The tissue.
Okay, and I'm trying not to go over, so just one, okay? Just one. And then I don't have my trash there, so I'm gonna throw it in there. Okay, here we go again. If I had a trash right here, I could use my foot even to get it. I could just go there. Okay, then a little bit further back, right? And I wouldn't have on these sleeves, y'all. If I miss, who cares? Okay, one more. And I'm okay with this dropping there if I need to because it's sterile. And then your last one here. Okay, and make sure a problem that people do is they get their gloves. See how I didn't touch my gloves when I went around? I won't do it again. Okay, all right, we are ready. Are you ready, Mr. Evans?
Yes.
Okay. All right. I need you to take a deep breath and just bear down. Okay, so it's not 90 degrees, but these won't go 90 degrees.
Okay.
Another thing, you want to be about 3 to 4 inches from the end, okay, of the catheter. Okay, take a deep breath for me. Sometimes these won't go in all the way. In fact, I'm meeting resistance right there.
So normally all that.
It would go in. It did earlier when I practiced. Okay, let me do this. Sorry, Mr. Evans. Sorry about you.
This is fine.
So now is it threaded through?
It's almost there.
There it goes.
Jeez, it's resistant.
Yeah, there it
Okay,
There it
so
is.
one thing I want you to notice is I am not touching my gloved hands to the tip of the penis. That would be breaking sterility. So what happens is people thread and they're just touching the end. I'm keeping back a little bit. It's not gonna go, y'all.
It's just
Can
a lot
somebody
of
pull
friction.
it for me? I'm gonna.
Wait, do
Okay,
this.
cool. Thank you. Okay. Okay, so you'd go all the way to the bifurcation. Okay, pull. All the way. This is called the bifurcation on a male. You don't go all the way to the bifurcation for a female. That is the bifurcation right there. Now, as soon as I'm done here, I'm done, right? And I know, what am I noting? Urine. Okay, there's a flash of urine. We're in the right place. I can let go at that point. It doesn't have to be sterile. How many cc's?
5.
Right, and it says right there, 5 ml cc's. You see it right there?
Mm-hmm.
Okay, so 5 cc's.
Mm-hmm.
They're so cool.
Okay. All right. Let me. So it doesn't matter now. I don't have to be sterile, right? Sorry, dude. Okay, so I don't have to be sterile anymore. I have this, the leg strap, Foley catheter leg strap. These are not tricky, but if you're used to the high-tech ones, they are. Just Velcros. All right, and then I'm gonna hang your bag. You doing okay?
Yes.
All right. Okay, so here's another thing. We never hook it to a moving part, right? Because what happens when we move the moving part? So on the bed, there's a non-moving part right there. So that's where I'm gonna hook it. And then,
Where do you see the urine? When you say
It'll come out the tube. It'll
Okay,
come out
you'll
the
see it
actual
in the
cake.
tube.
Yeah,
Okay.
it'll come out.
yeah,
Okay.
it'll come out right there. And then you just, at this point, I don't have to have gloves on, so I'm gonna take them off.
You'll see.
But I could put on those gloves, right? If
Yeah.
I wanted to. And then here we go. Want some gloves. Okay, how was that?
Painful.
Painful.
Jesus.
So on a male, what could make it painful? What are y'all thinking anatomically? Prostate.
Oh yeah, the prostate.
So if you ever feel resistance, you don't keep pushing. Okay, you would stop at that point. All right, I'm gonna.
We would just stop,
reposition.
or we would take it out.
You would stop and maybe say, relax for me. Maybe see if you still have resistance, and then just stop. You know, you could. I mean, you could just see if repositioning is what I'm saying. Repositioning would help. If not, you absolutely stop. Okay, let me get your comfortable position here. And I need to do some patient teaching with you. Anytime you get a Foley cath inserted, you're at risk for a urinary tract infection. So if you have fever, chills, pain in your lower abdominal area, anything like that, please let me know as soon as possible. Also, the first time you get up, please call us. Here's your call light, because you could trip over the tubing. If you have any bladder distension, sometimes these get kinked, and so let me know as soon as possible if you have any pain in your lower abdominal area. Do you have any questions?
No.
Okay, we're done. Thank you, sir.